Well, thank you everyone for being here. My name is Danielle Scholze. I'm one of the developmental behavioral pediatricians, and I work pretty much all the time in the Autism and Developmental Disabilities Clinic here at the Weisman Center. And I'm going to be presenting along with another person, so I'm going to let her introduce herself.
Hi, my name is Martha Walter, and I'm a psychologist here at the Weisman Center. I'm in a few different clinics, including the Autism and Developmental Disabilities Clinic and Down Syndrome Clinic, as well as on a research project. And so we are very happy to be here today talking about anxiety and autism. So during our presentation today, we will plan to talk a little bit about anxiety, about how anxiety disorders are diagnosed. We'll talk about the overlap of anxiety and autism, and then both behavioral approaches to managing anxiety as well as medication in the management of anxiety and anxiety disorders. So first, we'd like to talk just a few minutes about anxiety and what this might look like. One way that we can understand anxiety is that when there is a true danger, so something like a fire, someone breaking into your car or home, a large animal approaching, a type of alarm goes off in our bodies. This is a good thing because it helps our bodies get ready to handle the situation. It's that flight or fight response. However, some people have overactive or false alarms. So alarms in which their bodies may more frequently have these types of responses to different kinds of situations. For example, if your body's alarm goes off when a car drives by, rather than having it go off when someone's breaking into your car. And this can be a problem because our bodies are sort of tricking us into thinking that there are these true dangers when there may not be. Experiencing anxiety occasionally is a normal part of life. And as I mentioned, this can be helpful and adaptive because we have to be able to respond quickly and efficiently when there is a true danger or crisis. Anxiety becomes a disorder when a few different things are true. So one is if the anxiety is really significant and persistent over time, so not a typical reaction to sort of a frightening event, but instead really significant over response to events, or anxiety that may be more constant and generalized across many, many different settings and is not necessarily a response to a specific trigger. Anxiety disorders also involve a number of different kinds of symptoms, which we'll talk about in a moment. And finally, the anxiety, to be a disorder, must cause significant impact or suffering in someone's life. This last point is important. Many people are anxious part of the time to some degree, but for the anxiety to be considered a disorder, it must interfere significantly with daily life or day-to-day activities. So this slide shows some of the different symptoms we can see with anxiety, and in part, it can be the presence of these symptoms that help to differentiate anxiety from a typical reaction to stress versus anxiety disorders. So a number of different physical symptoms such as increased heart rate, breathing rapidly, sweating or feeling weak or tired, and then other types of things such as trouble concentrating or sleeping, feeling nervous or restless or tense, having difficulty controlling the worry. So the current system or manual we use for understanding the different kinds of anxiety and making diagnoses of anxiety disorders is the Diagnostic, and it's a mouthful, the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, DSM-5. And there are a number of different kinds of anxiety or ways that anxiety can present in individuals. Here's a few of them, and we won't go over them in detail today, but things like generalized anxiety, separation anxiety, selective mutism, and so forth. It is really important, it's important to know that there are these different kinds of anxiety, but it's very important to understand which type or types of anxiety someone may have, because this can really have a big impact on the treatment that would be most helpful and beneficial for them.
So the question of whether anxiety or anxiety disorders is more common in people with autism, many people think wouldn't be that difficult to answer, but it has proved to be really difficult to figure out. So there is an overarching, when you look at lots of different research studies, there is a belief that anxiety is more common in people on the spectrum. However, how common it is and why that is still really widely unknown. So the estimates of kind of people on the spectrum who have anxiety range anywhere from 10% to 80%. So it's a huge range. Doesn't really help us a whole lot. Most people believe that is around 40% is a more accurate estimate. And if you think about 40% in people with autism versus about a little bit less than 20% in the general population. So that's about twice as frequent as people in the general population who don't have autism. There are a few things that tend to predispose people with autism to being more likely to have anxiety. One of that is having a higher IQ. So higher IQs, higher cognitive functioning has been associated with an increased risk of anxiety. That being said, there's a question as to why that is. Is that an underlying issue? Is that because they're better able to verbalize anxiety and express that, which is probably a big part of it? And also, are they better able to maybe realize some of the things that are going on around them that could trigger anxiety? So there's a lot of different things that go into that. The other time that it's been seen that there's a significant increase in anxiety, I think in the general population, but as well specifically in people with autism, is during adolescence, especially in girls on the spectrum during adolescence. It's much more common to have anxiety in that group, and I think we can all understand why that would be. Another common time when anxiety tends to increase is also during transition, especially late in adolescence, early adulthood, when people are transitioning out into the community and there's just a lot of unknowns out there. So, what does anxiety look like in people on the autism spectrum? Well, first of all, it oftentimes looks exactly like everybody else, so it doesn't mean that it looks specifically different. But there are definitely characteristics that can be different and more noticeable in people on the autism spectrum who have anxiety. So obviously those physical features and those physical symptoms of increased heart rate and all that are still about pretty much the same. Those still occur. But very frequently it can cause emotional lability, so a lot of mood swings and moodiness. Behavioral challenges is a really common kind of symptom of anxiety in people on the spectrum. So aggression, anger, increases in self-injurious behavior and things like that. Inappropriate emotional responses, so laughing in at really odd times or just having a reaction to their environment that doesn't seem to make sense can actually also be associated with anxiety. Withdrawal and refusal to participate is really common. This is especially an issue in school. So when kids are in school and there's pressure put on them and they get anxious, oftentimes they shut down. Unfortunately, sometimes people see that as being defiant and difficult, but really it's that anxiety just shutting them down and them having a hard time dealing with that. So it's an important thing to keep in mind. Depression and depression symptoms can also be very frequently seen. And finally, sleep difficulties. Sleep definitely in the general population is associated with anxiety, but definitely more as well in the autism community. So is it anxiety or is it autism, or how do we figure that out? And that, again, is a really complicated question. The first thing I always like to point out is anxiety is not a core symptom of autism. So everybody who has autism does not have anxiety. You don't have to have anxiety to have autism, but we do definitely see it pretty frequently. So how do we determine, oh, well, this behavior might be more just kind of based off of the autism and a characteristic of autism, and when does that cross over into anxiety? And that can be really challenging to determine. One really big way that we determine that is by looking at baseline functioning, baseline presentation, and looking for changes in that. So are there big changes? Last year didn't see this behavior. Now this year at school, everything is kind of ramped up, and now we're having a lot more difficulty with refusal or things like that. Specific irrational fears, so really severe fears and kind of that phobia, those are typically really true anxiety disorders. Symptoms that worsen in response to environmental factors, so definitely transitions can be challenging for all people on the spectrum, but definitely kind of really significant behaviors with behavioral challenges with like school return. Also trauma, and I like to point out that trauma doesn't necessarily mean like a really big major trauma. It can be something small that a person may feel very overwhelmed by. So it doesn't necessarily mean it was a car accident or abuse or something in that nature. It could be something little that you don't even realize was traumatic to that person. So it's just really important to be cognizant that doesn't necessarily have to be a big event. And then finally, that the symptoms respond to treatment for anxiety. So sometimes we just can't figure out is this anxiety? Is there something else going on? And when that happens, sometimes we do try treatment and see how it goes. And if it does improve symptoms, then it probably was anxiety. And if it doesn't improve, then we can stop that treatment and then look for other reasons for that. So, if you think, so by the way, I'm a pediatrician, so a lot of this is my child, but this also goes for adults and yourselves. So if I think my child has anxiety, like, what do you do? And I think that's always a really hard a question, because it's like, well, where do I go? Who do I ask about it? The first thing to do is just keep track of it. Look at the symptoms. What do you see? What are the behaviors you're noticing? What are triggers? What things seem to bring that out? And when and where do those things happen? Because that can really help us determine how we treat it. Discuss it with other people who are around your child, so teachers, other caregivers, family members, anybody that spends time with that child. Figure out, like, are they seeing this? Is this are there behaviors that they're noticing in their environments as well? And then finally, talk to your child's doctor, or if you're an adult, talk to your own doctor. I always recommend that when you're going in to talk about anxiety or other more like mental health concerns, let the doctor's office know, because very frequently you're going to need more time. I mean, these are not things that are going to be a 5-minute in and out. So definitely let them know ahead of time that you have these types of concerns, so that they can slot more time for you, and also plan on maybe having that be a longer appointment. And then finally, oftentimes they'll ask you to fill out, paperwork or forms, or you may need to be referred to another provider to get that diagnostic evaluation completed. So don't go into that appointment expecting to come out with an answer. Oftentimes it takes a little bit of time to sort out what's going on.
That's a perfect segue. So if you are referred for an evaluation for anxiety for yourself, for a loved one, or if you are seeking that evaluation out yourself, there's a few places this can happen. So it could happen with your primary care provider or pediatrician if it's your child, but it may also happen with a psychiatrist or with a mental health provider, such as a psychologist. And the components, or specifically what will take place during an evaluation for anxiety, may vary to some degree, but in general will include an interview with the individual, and then with the parent if it's for your child, an informal observation with the individual who's experiencing anxiety, information from other people who know the person, so that might be school providers or other individuals, and then often rating forms that are completed by the individual who's experiencing anxiety, depending on their age, and then by people who know them well. So that could be, depending on the person, parents or school providers or others. So today we'll be talking both about some behavioral interventions or strategies for managing anxiety, as well as some medication options. And so we'll start with some of the behavioral approaches, the most common of which is called cognitive behavioral therapy, or CBT. So CBT is highly structured and has a strong evidence base for targeting symptoms of anxiety. And CBT does this by really helping the individual to become aware of their anxiety and their different emotional states, so that they can implement some strategies to help manage it. CBT teaches individuals a number of different things to recognize different physical, cognitive, and behavioral ways that anxiety manifests, to identify different triggers for anxiety, and to use a combination of different kinds of strategies to be able to manage their anxiety. These strategies can include physical strategies like learning different relaxation strategies. It can include cognitive strategies like problem solving and identifying our thought patterns and trying to make changes to those thought patterns if that's part of what's driving the anxiety. And then it can also include behavioral components. So in a supported way, having experiences to have exposure to whatever that feared situation is. So generally in CBT, the therapist will work with the individual to give information about anxiety, how anxiety disorders develop and how they're treated, and then they work together to understand, for that specific person, what are the situations that tend to make them most anxious, what are their specific triggers, and then work together to change some of those thoughts that may be contributing to anxiety, manage their anxiety feelings, and face their fears. Often this occurs in a one-to-one setting, but there are some great group programs available as well, depending on your area and what you're able to access. The other thing it's helpful to do is think about what are the other services or treatments or therapies or supports that the individual has in their life, and how might we think about modifying or optimizing those to have the greatest impact. The other thing that's so important and helpful is just that everyone on that person's team is communicating so that they have a good understanding of what's going on and can use consistent strategies across settings. So if you have someone in your life, such as a child, but it could be someone else who's experiencing anxiety, there's a few things that can be helpful to do. So generally, helpful strategies for helping someone deal with anxiety can be communicating your empathy in an effective way, modeling that brave behavior, because we all go through things that are hard and stressful, and so we can model kind of how might I handle that situation, what strategies could I use when I'm dealing with that. Trying to prevent avoidance of whatever the feared situation is, helping them remember to use those coping strategies that they're learning, and kind of reinforcing when they do use those strategies. Strategies that tend not to be helpful are excessive reassurance, being too directive or impatient, or kind of permitting or encouraging, completely avoiding whatever those fears are. A few other things that can be helpful if you're working with someone either at home or at school or in another setting who's experiencing anxiety can be like a number of different things. Having an organized and predictable routine at home or in the classroom can be really helpful. Preparing for transitions by letting someone know what's about to happen, why is it happening, and what can you expect that we're going to be doing next. Things like trying to dispel those myths or misconceptions about certain events by giving accurate information. Helping them remember, hey, you did so amazing when you did this thing last time, and remember how you used X, Y, or Z to help deal with that situation, and you successfully handled it. Visual supports can be really, really helpful, both to understand the person's anxiety, like a feelings thermometer where you can keep track of how it's going over time, as well as supports to make things more concrete. And then using positive self-talk, like I did this before, I can do it again, and just normalizing and modeling those things too.
So I'm going to move on and talk a little bit about medications. I wanted to start off with just a really brief discussion about medications and autism in general, just so that everybody is kind of on the same page. The first thing I always want everybody to know is there are no medications that treat core symptoms of autism. So there are no medications that treat kind of social challenges or repetitive behaviors or restricted interests. The medications that we do use are focused on treating co-occurring conditions like anxiety or ADHD or aggression and things like that. When we're thinking about medications, the first thing is to figure out what are we targeting for symptoms and how is that affecting the person's life. So when we're thinking about medications, we want to look at a medication that is going to help with symptoms that are actually impacting the function on a day-to-day basis. We want to always think about benefits and risks. What are the alternatives? What other things can we use before going to medications? What are side effects and adverse reactions? The response of medications is extremely variable from person to person, especially in people on the spectrum. What we know is that medication use, when we do use medications in people with autism, we tend to find an increased risk of side effects, and they don't tend to work quite as well as in the general population. So that can be really frustrating for families and for people who are trying to use these medications to improve. It may take a lot of medications before you find the right one. The last thing is probably the most important point, and medications should not be used alone. They should always be used in conjunction with other interventions. So behavioral interventions, educational, psychological treatments, they should always be in conjunction with other things. We should not be relying only on medications alone. I'm going to talk really briefly about this because I want to move on to a little bit more stuff before we run out of time. But when you think about medications, especially in children, there are very few medications that are approved by the FDA for use in children. Anxiety, there are actually none that are approved for anxiety in children. There's some that, but they are approved for other conditions. So that's kind of where we extrapolate the information that we use. There's very limited studies in children and even fewer studies in kids with autism. So when we look at treating anxiety, by far, the most common medication that we use is selective serotonin reuptake inhibitors, or SSRIs, and many people have heard of these: fluoxetine or Prozac, sertraline or Zoloft, paroxetine or Paxil, and there's several other ones. They are used to treat anxiety and depression, so they can be good for both of those things. Benefits can be seen in a week or two, but typically it takes more like 6 to 8 weeks to really see the full benefits of these medications. Which of these medications a provider decides to use can be, it depends on a lot of factors. So it can be provider preference. So for example, I may have a lot more experience with one certain medication. Age has a lot to do with it. So there are definitely some of these medications that have been much better studied in younger kids versus older kids. Also FDA indications. So some of them are actually indicated for older kids versus younger. The method of administration. So can you swallow a pill? Do you need liquid? Any co-occurring symptoms, and then finally family history. And I always strongly recommend, if you have a family history of anxiety and you take a medication that works really well for you, let the provider know that, because we definitely take that into consideration, and I tend to preferentially choose medications that work better for family members first, because it's more likely that it's going to work better in the individual that I'm trying to treat as well. So side effects of SSRIs, usually they're pretty well tolerated, but like I said again, people on the autism spectrum are more likely to have side effects, unfortunately. Common side effects are dry mouth, nausea, diarrhea. A lot of times people will complain about diarrhea early on. That usually does get better, so that's good. Headaches. Some people become pretty drowsy and tired on SSRIs. On the flip side, though, there is a group of people who become activated, and they almost become kind of really wired and hyper, and that can be a huge problem, especially in people on the autism spectrum. So it's kind of weird that you have this kind of differing reactions, so it's not, we aren't able to predict who's going to have those reactions, but it's one of the reasons we like to start medications at a low dose. Insomnia can occur as well. And then finally, sexual side effects, which I think a lot of people don't talk about, but decreased libido, decreased sexual arousal can definitely happen with these. And then sometimes that's really problematic, and other times it can actually be beneficial for some people in certain situations. So it's just something to keep in mind that people forget to ask about. There are black box warnings on all of these medications, as well as a lot of other medications that are used for different psychological conditions. And what that black box warning is that there was an association with increased suicidal ideations in children and young adults who are on these medications. It's really hard to tell what this means. So it was a very tiny percentage of the people who had this occur, but there was a very small increase. And so the reason that we make sure everybody knows that is we want you to think about that. We want you to talk about that. It's very rare, but you want to be cognizant of it. And if it does come up, you want to be aware of it and you want to address it right away. Follow-up, you want to follow up with a provider on a regular basis. We want to look at how effective it is, whether we need to make dose adjustments, look for side effects, especially, like I said, you should be asked every time you go in for a follow-up about suicidal ideations or behaviors. And then finally, these are medications that if you're going to stop them, they should be tapered. Don't just cold turkey stop them. You should be tapering them with the advice of a physician. There are several other medications that can be used for anxiety, but I will tell you they are typically not used very often. So the TCAs or tricyclic antidepressants, we oftentimes don't use them. They tend to have more side effects. There is also a huge risk of fatality with overdose, which is always a huge concern. So most of us tend to steer clear of those. Mood stabilizers like lithium, which were developed for bipolar disorder, but also can help with anxiety. And then there are a lot of anticonvulsants that also work as mood stabilizers, so those are listed as well. So these are some of the other medication options, but far and away that the SSRIs are most commonly used. So a couple of things I wanted to touch on. The first thing is stimulants like methylphenidate and Adderall are very frequently used for the treatment of ADHD, and for some people they really do help. Unfortunately, for a lot of people, it can actually make your anxiety symptoms worse. So that is something that's really important, especially if you have a child that may not be as verbal or as able to express themselves. It's really important to think about that fact, that maybe if you're treating and things are getting worse, it could be that anxiety is increasing. The other one, and I get asked this question very frequently, can I just have a medication to calm them down just in those moments when I needed something fast? Benzodiazepines are what has been traditionally used for kind of those anxiety attacks or short acting. They really should be avoided, especially in children and adolescents. The problem with them is there is a high likelihood of tolerance, so over time you need increasing doses, which can be associated with overdose, which can be extremely dangerous. They also tend to develop dependence, so over time you need it, and when you stop them, there can be really significant withdrawal symptoms. They don't have great side effect profiles, especially in kids, and most of the time we recommend that those are really reserved for hospitalizations. So I know a lot of people are like, oh, if we could just get through this blood draw or this dentist appointment, but there are definitely huge risks with using those medications, so we don't recommend them. So we wanted to end up with just some resources. So these are some of the resources that we frequently use in our clinic and provide to families. So I'm going to leave that up there, and then I'm going to open it up for questions because I know we are a little bit behind and just have a few minutes. So does anyone have any specific questions? And we will also both be on the panel at the end. So if you guys think of questions about anxiety or anxiety topics, we'll also be back at the end, so you can put those on those questions as well. So.
Is there a way to access your presentation?
Yes. So after all the presentations that are featured today with Day with the Experts will be on the Waste Center's YouTube channel, and they'll also be archived on the Day with the Experts webpage. We'll have the video links to the talks today as well as PDFs of all the PowerPoints. Any other questions? Oh, back here.
Hi, I read Attitude magazine. I have 2 boys with autism as well as these commingling symptoms, anxiety and ADHD. I have read that there are some video games that are by prescription only that may show some improved symptoms of, with anxiety. But I was wondering if you've heard of them, and I know some of them are don't have a lot of data yet. They're still collecting data. Could you address that?
Yeah, and if you have some thoughts, you can too. Yeah, so as far as them being prescription only, I don't know of anything as far as video games or apps or anything that would require a prescription from a physician. Like you said, there is not great research in that. I have worked with an ADHD researcher who does specifically focus on like the video games for treating. And I think, although there is a lot of possibilities in the future, I don't think we're quite there at this point. I don't see that research right now to support that it really works well. I always tell people, if you have the ability to use those things or try those things out, I don't think it's a bad idea, but I always recommend kind of thinking about resources and your time, and are there ways that could be better kind of used to spend that. But I think I think there's a lot of focus on that right now. So my hope is that in the future we'll be able to utilize some of those strategies because of the really significant difficulty of getting kids in for therapy and help. It's a great question.
We have a question back here.
Mm-hmm.
I was wondering, what do you think about physical activity and exercise is helping with anxiety?
Yeah, I mean, I think that can always be a really helpful thing for different kinds of anxiety or mood concerns. Sometimes it might be thinking creatively about what that looks like for an individual person and what they'll really enjoy, but absolutely it can be really beneficial.
Yeah, I would definitely second that. Also, just, for kids and adults, we do know that that's oftentimes what a lot of the therapists recommend is to get regular exercise, especially being outdoors if possible. And that also is helpful for not only anxiety and depression symptoms, but ADHD. A lot of kids do much better if they have ADHD when they have exercise and kind of a regular way to move and kind of burn off some of that energy.
The question over here.
Just a quick follow-up to this one back here. Are there any, are there any video games or computer programs or anything that are associated or correlated with higher or lower degrees of anxiety? Do this, play this, it raises or lowers anxiety?
I am not aware of that, so I don't know about that. I'm not aware of it. I don't know if any.
Are there any coping mechanisms that might be specific to when kids on the spectrum don't have access to the things that their repetitive or compulsive behaviors, and they express a lot of anxiety over that?
So when they don't have access to specific things, I think that's a little tough to answer because it might be so highly individualized, but certainly there are a number of different kinds of coping strategies we think about, and some of those behavioral and physical and cognitive ones that I mentioned earlier. But there also can be some. It can be helpful to think about what is that person's interests, and can those be used in a really planful way to help impact the usefulness of some of those coping strategies, and so oftentimes some of those interests can be incorporated in sort of a adaptive way, but I'd be happy to talk more. I don't know if you
Got a question right over here?
Oh, I'm sorry, please.
Go ahead, no, go ahead, I'm good.
How does anxiety show up in like nonverbal autism?
Yeah, so what we tend to see more is a lot more of the refusal behaviors. So lots of refusal behaviors, also like increases in aggression, increases in self-injurious behavior. So that's a lot of times what I see, and sleep issues as well. Yeah, so that's what I see most commonly.
So I think we are going to end for questions for now.